Okay, so it's not going on the screen properly, so I'm going to have to read it like this. So I've just created a letter for people to send to their MPs and councillors about the current situation of small fiber neuropathy care in the UK. So the letter says, urgent, no treatment pathways for patients with small fiber neuropathy, call for action and review of NHS access to treatment. So dear MP councillor name here, I'm writing to you as a constituent to urgently ask for your help and advocacy on behalf of my friend and many others suffering from a rare but increasing neuromuscular disease called small fiber neuropathy. Despite its serious and often life limiting nature, there are currently no effective NHS treatment pathways for SFN, leaving patients without access to therapies that could halt or reverse progression. The only options currently offered are painkillers, which do nothing to address the underlying disease process. My friend Nadia Erlem developed SFN earlier this year, May 2025, but is already experiencing severe disabling pain and mobility problems. They are now feeling nausea most days, and it has spread to their stomach, and basic tasks are becoming more challenging. Without treatment, Nadia is at risk of real further deterioration and quickly. Why urgent action is needed? Evidence and patient experience strongly suggest that immune-mediated SFN, which many cases are suspected to be, in fact most idiopathic ones are considered to be, can respond positively to immunotherapy such as IVIG, CGIG, plasma exchange, or immunosuppressants. This allows many people to recover or even fully recover in some cases. NVG2089 is being developed, which is a synthetic and more powerful version of IVIG, but that's still in trial phase. However, under current NHS policy, IVIG is not approved for SFN, even though similar immune-mediated neuropathologies are eligible for this treatment. This leaves SFN patients in a medical and policy grey area, unable to access potentially life-changing therapy and the potential for recovery and hope. What am I asking for? Please could raise this issue with the Department of Health and Social Care and request UK Plasma Advisory Board to review the list of approved conditions to include small fiber neuropathy, particularly for suspected immune-mediated cases. It's not always possible to prove immune dysfunction as it's constantly evolving. 2. Support calls for increased research funding into SFN and related neuropathies to identify cases and effective treatments as soon as possible. There seems to be no research on developing more drugs to stop the spread of the disease. 3. Ask NHS England to conduct a formal review of current pathways for SFN patients and develop clear clinical guidance to ensure equitable access to diagnosis and treatment. 4. Encourage expansion of plasma and blood donations in the UK so that life-saving IVIG therapy can be made available to all who medically need it. Currently, private IVIG treatment for SFN is unaffordable, around £60,000 per year, and many patients are refused even basic diagnostic testing or consultants with knowledgeable knowledgeable specialisms. Without change, patients like me will continuously deteriorate, becoming potentially wheelchair-bound, bed-bound, or suffering life-threatening complications. It spreads to other organs such as your digestive system, heart, lungs. Rates of severe chronic nerve pain and suicidality among SFN patients are tragically high. Surely, access to potentially disease-modifying treatment should be determined by clinical need, not by outdated policy restrictions or funding barriers. I'll be deeply grateful if you could raise this matter in Parliament or with relevant NHS and advisory bodies, and support Nadia and others in getting access to treatment trials and compassionate programs while systemic changes are being considered. Then my details. Thank you so much for your time and your help on this urgent, life-altering issue. I would welcome the opportunity to discuss this further and provide supporting information and evidence from studies and patient groups, and then you can put your details there. So yeah, so if you guys can help by spreading that would be... So yeah, if you guys can help by spreading the email as much as possible to your MP, Member of Scottish Parliament, and or the councillors for your area as well, that would be greatly appreciated.